So the regulator has also declined to look into at least 89 dangerous incidents where staff were exposed to risk, claiming there is a lack of evidence. Now, morale within the NHS has always been considered low. Long hours and pay being their main concerns, obviously, but failing to investigate the death of staff may well tip a lot of them over the edge. And joining me now to discuss the welfare and safety of NHS staff is Dr Richard Vautrey, Assistant Secretary at the Leeds Local Medical Committee. Thank you very much for joining me. Right, so, OK, just run us through, ground us, earth us in this. What's the actual problem there? So NHS staff dive believed to be from COVID, is that right? And people aren't investigating it?
Yes, this is a real concern. We all know that countless people died during the pandemic, and that included healthcare staff, people on the front line providing care to patients in hospitals, in general practice settings, and elsewhere. And particularly at the beginning of the pandemic, they weren't provided with the necessary PPE of sufficient standards to be able to protect them when they were in direct contact with their patients. Now, in any other setting, if you were in a construction industry or other settings sort of where someone had an accident at work and when they died as a result of an incident at work, you would expect the health and safety executive to investigate that and to see whether any lessons needed to be learned. And we haven't seen a similar intervention take place for healthcare staff. And I think that is a concern.
OK, all right, that's interesting. I mean, well, what is this doing for morale in the NHS at the minute? I know the morale of patients is pretty low, to be honest with you, at the minute. How's the morale of staff?
Our staff, both in hospitals, community, general practice settings, the morale is really low. We don't feel that we've had the opportunity to recharge our batteries, to rebuild our both physical and mental well-being following the worst of the pandemic. Because, as we all know, the situation in the NHS continues to be very pressurised. We've got huge backlogs of care. We want to be able to see as many patients as possible. GP practices seeing more patients than ever. Hospitals are trying to deal with huge waiting lists. And we need as much support as we possibly can from government at this stage. And one of the ways that we can be supported is to take these really important issues of staff protection seriously. And at the moment, we don't believe that that's being done with sufficient strength.